Welcome to Fourth Trimester Voices. Today, we have the pleasure of speaking to Dr. Sarah Ionescu. She is a remarkable individual who seamlessly balances her roles as a family physician, a fitness enthusiast, and a dedicated mother of five. Sarah has a deep commitment to health and wellness. Dr. Ionescu has inspired so many individuals through her YouTube channel and through just her positive energy. I am so happy to have you on our show. Welcome and thank you for just gracing us with your presence. Do you think that you can just tell the audience a little bit about yourself? Who are you? What do you do? And what are you known for?
Absolutely. So, like you said, I'm Dr. Sarah. I am a
Mhm.
family physician, a wife, a mom of five, ages 3 months to about seven and a half,
Mm.
and an exercise enthusiast. And I practiced as a family physician for about 6 years. Ultimately, I quit the job that I was at for multiple reasons,
Mm.
but I was pregnant with my fourth baby at the time. And I basically spent like a year and a half kind of just figuring out like where I want to go, what are the things I want in life, like
Mm.
where are we going here? And during that journey, I have always been really passionate about exercise and fitness. And I had some blips in the road along the way and figured out some tips and things that helped me be able to stay active in a way that felt really good for me and my body through most of my pregnancies and the postpartum periods while breastfeeding and all the mom things, while
Mm.
also navigating being a full-time doctor through many of those pregnancies. And so I realized that I have a lot of things to say about movement and exercise, especially as it
Mm.
pertains to moms and moms of obviously moms of multiple kids or really any kids, because I think that it's just so important as a mom to inspire your family to move. And so that sort of got me started on this social media journey. I was nowhere, anywhere on social media at all. And I basically started a YouTube channel. I got an Instagram account, like started all these
Mm.
things from scratch. And I started posting about movement and like all different things about it, demonstrations, different things you can do while pregnant, while early postpartum, tips, mindset things, like all these things. And so that's where I'm at right now.
It's nice to be able to pivot and be able to say, well, how can I do what I love? How can I still help and heal, but don't do it in this way that I thought I would? So you have five children, which is amazing. And I have so many questions about that. Number one, did you always know that you wanted to have a big family?
Absolutely not. So my husband and I had always talked about having two.
Mm-hmm.
We are both like, we both have one sibling. And so
Mm-hmm.
and nobody, like my dad is one of, well, he was one of six. He was one of five growing up,
Mm-hmm.
but there's not a lot of big families otherwise. But after we had two, we sort of had this conversation of like, think we want to have more. And it was like,
Mm-hmm.
I am somebody that like pregnancy, like I really enjoyed like the pregnancy journey and the baby phase, like the newborn phase. And that certainly helps, I think, because I think sometimes that newborn phase can be really, really challenging. And of course, there's moments
Mm-hmm.
that I had that too. But the fact that that was something I enjoyed, I think obviously made it easier to make the decision to have more. So yeah, we didn't really plan like, oh, this is how many we'll have. It was just sort of as we had the next one and the next one, it was like it didn't feel complete yet, I guess. And so
Mm.
that's how we sort of ended up here.
I love it so much. You are obviously into fitness, and
Yes.
tell me about what role fitness played in just making it possible for you to have these children. Because I'm gonna tell you, I was pregnant with my daughter and I hated pregnancy. I could not move, I could not exercise because I had horrible SI joint dysfunction
Mm-hmm.
and so I was miserable and I hated it. And then postpartum, I hated it. So people told me you're gonna miss being pregnant, you're gonna miss it, and you're gonna want to do doing it
Like,
again and
nope.
again and again. I was like, no, no, no. So when I
Yeah.
see, and the thing is, I love children. So I would love to have five or many kids, but I dread getting through that 9 months. And so
Yeah.
how did fitness help you be able to get through pregnancy, childbirth, postpartum times five?
Yeah, absolutely. So I was a competitive athlete growing up. I swam through college. And then when I went to med school and did residency, I really had a hard time sticking with staying active consistently. Like it would go in spurts, but I
Mm,
had a hard time because of the life change and because I was so used to it being defined by like I'm going to be out there, I'm going to be super sweaty, like it's really vigorous. And if I wasn't able to do that, then I did nothing because I just didn't think anything else counted. When I got into that phase that I was describing that led to me quitting that last job, I used exercise as a form of self-care even like
mm,
well before I quit. And so at that point, I had really realized how important fitness was to all of those pregnancy and postpartum journeys. And so I think with my first pregnancy, because I had no other kids at the time, obviously, I was active all the way through. And then after that, after my first daughter was born, that postpartum period was really hard for me because
mm,
of how gentle you have to be with your body. Like I sort of thought once the baby's out, I'm going to be doing what I was doing the day before I delivered.
mm,
Not that is obviously not accurate. And
mm,
I had told patients that because I'm family medicine. So I took care of patients that were pregnant. I delivered babies as part of
mm,
my training. But I think until you physically experience it, you cannot fully appreciate or understand what that feels like when you
mm,
are newly postpartum. And so the first postpartum period was really hard because I did not know how to navigate it in terms of fitness. And so
mm,
I really just did literally, quite literally nothing until my 6 week postpartum visit. And at
mm,
that visit, the doctor was sort of like, okay, you're a doctor, you're good, you know what to do, like, go ahead.
mhm,
And just kind of like shook my hand and said, see you later. And I sort of was like, what? Like, I had no idea
mm,
what to do. And so I ended up with some injuries because I tried to get back to stuff like way too quickly
mm,
without working back up to things. And anyway, over the course of the 5 different pregnancies I've had, I have learned through going to things like pelvic floor physical therapy and
mm,
talking with experts about how to heal properly and when to layer in different types of exercise. Plus, I've done a lot of my own learning and a lot of my own experimentation. I've learned how to do that effectively and safely. But really, the most important thing was learning how to give myself grace in
mm,
that immediate postpartum period
mm,
because I think it's not like a lot of people will talk about wanting to bounce back and like
mhm,
getting back to that fitness level or back to that weight and all of these things. And I really struggled with that concept because why do you want to go backwards?
mm,
And you're also a different person. Like you're still you, but you're like a different version of you. Like you said,
mm,
you have almost like this different identity, and it happens every time. Like every time you have a baby, it's like things shift and change, and you're like a little bit of a new version of yourself. And
mm,
so you have to take the time to sort of redefine what exercise and fitness is for you in that time.
mm.
And you can edit that as you go and as you progress and become further along and stronger and all those things.
Oh man, so many gems, so many gems. And I love what you say about that you are not the same, right? And so try to adjust your fitness and your recovery to who you are now.
Mm,
And I often hear moms talk about, well, this pregnancy was different from that pregnancy, and this pregnancy was different from that pregnancy. And so you have to assess where you are with your current situation. Oftentimes, moms may have been running that marathon beforehand. And so when they have the baby, they want to get back to running the marathon. And it's good to hear this from a physician too, to say, guys, like, I've experienced this, right? I know you want to bounce back, but it's not worth the long-term side effects that it may cause your body because so many women are so eager to do the things that they were doing before pregnancy. And I just love that you went through that and you're able to talk about that. I would say when I often talk to moms too, they don't know where to start when it comes
Mm-hmm.
to exercising. I had a mom shower in Atlanta, and a lot of the moms were asking questions. So, what should I be doing during pregnancy to prepare my body for postpartum? What exercises can I do? And then are there videos? Where do I even start? And so for moms who are looking to get active and really prepare themselves for a really good recovery period, where can they start during pregnancy in terms of exercising?
Yeah. So I think that was part of why I started my YouTube channel because
Mm,
when I was pregnant the first time and then really the postpartum part, like everything that I tried to find because I had been going to a gym.
mm,
Obviously, like leaving the house to go to a gym was just not going to work. And so I was trying to find things to do at home and everything that I found it just felt so like aggressive. It just was like very aggressive. And it was
mm.
like these people that were incredibly fit and like, I'm 5 weeks postpartum. And they're like already doing all this wild stuff. And it was like, yikes, I can't do that. And so then I just
Wow.
chose to do nothing because I felt like I couldn't find things that seemed to be safe and reasonable and also that I could do. Like
Mm,
because you're really starting from a new baseline. And so that was part of why I created my YouTube channel because I thought this could be a place where there's things that are reasonable for both pregnant and postpartum women to do that is not wild. It's safe and it's like doable time wise. Because if
mm,
whether it's your first pregnancy or you already have multiple kids, obviously we're all really busy. And so trying to be like, okay, I'm going to do this thing for 45 minutes. It's like, yeah, heck no, like I don't have time to do that. So keeping it like short and sweet and to the point. I think that one of the reasons to be active during pregnancy is because it does help make the labor and delivery process usually go somewhat smoother
mm,
and the postpartum recovery part goes smoother. I have seen that in like personally with pregnancies that I was maybe less active or less consistent. And
mm,
then the recovery was not as smooth as other ones where I was like very consistent in terms of like specifically what to do, I think walking is a wonderful activity, especially when pregnant and postpartum, because it's super gentle. You can always bring your baby with you, right? So, like, whether you're massively pregnant, you can usually do it in spurts. If you have a newborn, you can wear them, you can have them in a bassinet stroller. Like, these things are friendly to bringing the baby along. And so,
mm,
that's why I think something like starting with walking is incredible. Another thing, like one other thing that maybe sounds, it's not silly, but it's like very, very simple is breathing. So
mm,
it's called like 360. Some people call it 360 breathing, diaphragmatic breathing, deep breathing. There's all these different names for it, but it's basically an intentional type of breathing where you connect the breath with your deep core layer of abs. And that breathing is critical as the foundation of postpartum recovery. It can help again with labor and delivery with that type of breathing. And it has mental health benefits because it connects you to your nervous system and helps calm your nervous system down during moments of like
mm,
stress and overwhelm. And so for somebody that maybe is not terribly active leading up to pregnancy, breathing is something obviously everybody does anyway. So it's not like you're starting a crazy brand new routine.
mm,
And some of the pelvic floor exercises that are wonderful for postpartum, you can absolutely start doing those pregnant. because that will help get you sort of a baseline with your pelvic floor that then can help with the
Mm,
recovery afterwards. And if I wish there was one thing that I knew the first time that I got pregnant, it was start working on your pelvic floor like
hmm.
now, wherever you are now,
Yes.
but especially if you are newly pregnant or you're thinking about getting pregnant, because I never learned about it or thought about it until
Mm.
after I had delivered. And then it was like, oh, I really wish I had been doing some of this stuff beforehand.
Yeah, I mean, we don't, as physicians, I don't think we really are. Really don't go through and talk about pelvic floor therapy because even for me, I think it was 2 years postpartum before I was sent to a pelvic floor therapist. And so now when I chat with moms and I meet them during pregnancy, I'm like, make an appointment because it really should be like we go see our PCPs on a yearly basis just to make sure things are working well. And I feel like before you enter pregnancy, before or during, you just really need to check in, see how the pelvic floor
Yes,
is, how it's doing, and then do some exercises to try to one, strengthen you, try to get you to childbirth. And also it just does make the working out and the recovery afterwards so much easier because I think the most danger that people don't know that they're putting their bodies to when they're like jump into exercises in the pelvic
yes,
floor. And the pelvic floor will not speak until months and years later. And so people are like, yeah, I started working out day one, week one, but that pelvic floor is speaking,
right.
and that damage can be long lasting. So I love hearing your emphasis on pelvic floor as being a huge part of postpartum and just even pregnancy fitness because it
Yes,
cannot be neglected. It needs to be worked out too. So,
yes, absolutely.
oh man, what do you think more moms what do you wish that more moms understood about just fitness and recovery and pregnancy?
Yeah. I think that it doesn't have to be complicated, and
Hmm.
it doesn't have to be a lot of time or a lot
Hmm.
of money or a lot of equipment for it to be effective, because
Mm.
that's what I thought. But when I finally realized, like, okay, I'm never going to have, like, until who knows when, I will not have the amount of time that I used to exercise when I was a college athlete, but I
Mm.
need to do something. I need to get moving. And literally starting at like a minute a day of something is better than zero. And I think fitting it in even while the kids are awake or next to you, or if they're big enough, they're doing it with you. I think that is part of the journey. And I think that helps teach them that one, you appreciate and treasure your body and you're taking care of it. And then it teaches them to do the same with theirs. And then overall, the family is a family focused on movement and health and all of that. And so I think it's really that it's that it doesn't have to be incredibly complicated, lots of time. It can be simple and quick, and you can still see wins with that.
Mm. And it sounds like your perspective, honestly, on just fitness has changed over the years. And
Yes.
so talk about that too, because I think we all have different journeys when it comes to our fitness level, right? You were an athlete, and some of us go through times in life where we're working out to try to be a certain way. We want to keep slim and fit, and some of us go
Mm-hmm.
through life where we're working out for exercise. But I sense you're at a place where fitness is really a part of your self-care journey, and it may not be what it was used for in the past.
Yeah. Absolutely. I think that, like I sort of alluded to, I really had to redefine what exercise was for me,
Mhm.
and it has evolved and now is certainly part of my self care. And on days where I don't do it or I do less, I definitely notice more, sometimes physically, like I'll feel stiffer, maybe have some pains, but definitely in terms of like patience with taking care of the kids, being able to handle all the things that life throws at you, like all of these things, certainly it has played a very important role for me. I think that exercise has sort of a dual, I mean, there's many different roles for it, but definitely obviously we all know about the physical benefits, but I
Mm,
think the mental health benefits are often sort of like underlooked. I think that even just a few minutes can make a really big difference in terms of your mindset, in terms of your stress levels, your anxiety levels, all of that. And that's not to say that if you're having those things, you shouldn't be doing other things like having therapists and talking to your doctors and all of that.
mm,
But moving can definitely play a really important role there. And I think the other thing that I always try to make sure that I talk with patients and other moms about is, again, like it doesn't have to be a certain thing to count. Like if you
mhm,
stretch for 5 minutes, that absolutely counts. Like count it, because the more you count those things, the more you feel yourself believing that you are a person that moves, you are a person that exercises. And then as that becomes a habit, you build on it. And maybe then you're layering in, oh, now on a few days a week, I add in a walk or I do strength
mhm.
training. As you progress, you can layer on these situations where you're working on building your strength over time.
Wow. And I think that sometimes moms, with everything that happens in the postpartum period, can feel overwhelmed, lots of emotions. And so, in turn, they just may not want to just do anything, right? And so,
Yeah,
I love the permission to just do anything, even if it's a 1 minute stretch. And I think moms need to hear that because sometimes it's you just. Postpartum is hard, and starting somewhere is better than nothing. For sure.
absolutely. And I would start with, I mean, something, if anybody's done yoga, like a lot of people will
Hmm.
hear of what's called child's pose.